HomeoCare, the chain of world-class homeopathy clinics with world-class care.
Hello friends, welcome to the third lecture of this series on pediatric case taking. In the first two lectures, we talk of the SAD axis, the 2 points of the SAD aspect. In the first lecture, we talk on the sociability aspect, and in the second lecture, we talk on the activity aspect. So in this third lecture, I am going to talk on the distractibility part that will complete the SAD axis. However, when I introduced this word distractibility, it caused few confusion among homeopaths. So when we use the word distractibility, they think that the child is coming to the clinic and breaking a lot of things. So this distractibility word was little high in the intensity. So then later on I have changed this word from distractibility to aggressiveness so that the meaning of the word is more conveyed. So when we are talking of distractibility, we will now not use the word distractibility but will use the word aggressiveness. So in this third lecture, I am going to talk on the aggressiveness of the child that will complete the SAD axis. So what do you mean by the aggressiveness child? When we see a child, we have to identify whether a child is an aggressive child or a non-aggressive child. An aggressive child is the one who frequently and shows violent behavior such as hitting, kicking, shouting towards others, or smashing and ripping things, tearing papers and other things. So an aggressive child will constantly interrupt others. So in between, when the few children are talking, they will come and they will make their point very aggressively. They'll interrupt others. They will demand. They will make lot of demands. They will give ultimatum to their friends, to their parents, or they assertively will get what they want. So this is also an aggressive behavior. So the few words which we can use for aggressive behavior is also an assertive behavior or a strong behavior. Now exactly opposite is a non-aggressive child. A non-aggressive child is a calm and can handle anger situations very easily and peacefully. In situation of anger, the child ignores the situation and then moves ahead and does not react much. If things are not going according to his plans, they are still okay and they will not be very pushy or not be very assertive in their demands, in their actions, in their reactions. So this is a non-aggressive behavior. In this series of video, next series of video, I will be showing you few clips where we will be identifying whether the child is an aggressive child or a non-aggressive child. We will be seeing some reactions. We will be shouting at the child, or we will see how the child reacts in a situation, whether the child reacts in an aggressive way or a non-aggressive way. So friends, continue watching this video. Let us go to our clinic and see how few patients are reacting, and let us try to understand and assess whether the child is an aggressive child or a non-aggressive child.
वो भी चेक करेंगे।
हाँ वो भी हाँ अंकल चेक करेंगे। अच्छी को थोड़ी ना आता है, अच्छी को मालूम पड़ता है कुछ। चिमटा क्यों भर रहे हैं?
डॉक्टर को डांटेंगे, हाँ फिर इंजेक्शन दे देंगे आपको।
गाड़ी चलाना चलाएगा?
चाहिए इंजेक्शन? लगाओ इंजेक्शन, लगाओ लगाओ ऐसा।
ऐसे क्या क्या पीयूष ने?
पीयूष ने क्या किया आपके साथ?
हाँ
फिर आपने क्या किया बाल खींचा? पीयूष को मारा आपने? चिल्लाया?
पीयूष ने बाल खींचा क्यों?
कैसे बाल खींचा पीयूष ने बताओ? ऐसे बाल खींचा फिर आप रोए?
और इसने पीयूष से क्या मस्ती किया?
कैसे मारता है पीयूष आपको? ध्रुव यहाँ पर देख कैसे
इधर
मारता
देखो,
है?
अंकल जी का फोटो खींचो। जोर से बोलो। ऊपर देखो मेरे पास। गुड बॉय है? नहीं, एकदम बैड बॉय है। हाँ चिंटू, बैड बॉय है? बैड बॉय है क्या? ऊपर देखो। बैड बॉय है? मस्ती बहुत करता है। मम्मी ने बोला बहुत मस्ती करता है।
कैसा भी सर्दी खांसी उसे
सर्दी थोड़ा है, नाक बहुत जिद्दी बन गया, जो चीज दिखा रहा है उसको चाहिए।
ए नहीं मिलेगा। क्या है? नहीं मिलेगा।
और मम्मी ना
जिद्दी है।
बहुत ऐसा रोएगा जैसे दिखाओ तो सही बात। रॉबिन cuma muka kami dah. Ada muka tanah kami onu चाहिए.
ओके ओके। What is that? Give me. क्यों मारा वापस से उसको? तेजस तेजस ए तेजस ए तेजस ए क्या करिए?
मैंने बोला ना दूध पीते बोल बोला ना नहीं सुनते नहीं पीने का डॉक्टर అయినా అన్ని పర్రవల్లిగే బిస్కెట్ పల్లె పర్పుల్ వల్లే
ए तेजस ए
अंकल
हाय करो, चलो हाय बोलो।
हाय बोले ये लो हाय
हाउ आर यू?
बोले ये कौन हो रहा है इंच ना वाला ये लो अंच कर रही अंदर